refers to poor memory, poor concentration, frequency of urination. Some individuals under stress, they are tempted to get addicted to substances, mostly alcohol and other drugs. We know that life is full of stress. You cannot be here without stress. Even as I'm talking here now, or you're listening, we are each of us under stress. So eating is a stressor. And the biology of stress has it that the central nervous system, that's the brain and the spinal cord, play a crucial role. The important part of the brain, hypothalamus, amygdala, these are involved. The hypothalamo-pituitary axis is the major system that is implicated in stress. Then what actually happens? So when one is under stress, there are stress hormones that are released. The most important is the cortisol from the adrenal gland. This cortisol is, okay, so this hormone prepares the body for fight and flight. So cortisol is one of the hormones that is released. Apart from cortisol, we also have something like adrenaline, but the commonest is cortisol. Now what does it do? The cortisol pushes all the blood pressure. The pulse rate is increased, and heart rate is also increased. Cortisol is toxic, so if you allow it to circulate for a long time, it means that you are putting the body machine into stress. So cortisol is expected to be released and discarded within the shortest possible time. So, but if one is chronically under stress, like one who is working in emergency, maybe 8 o'clock, they run to somebody, accident victims. As you are pursuing accident victim, one with bleeding is rushed to. So maybe from 8 o'clock till the person dismisses. So the cortisol is circulating. Yes, so if the by cascade reaction, excess cortisol is removed. Dopamine neurotransmitter is also produced. This dopamine impairs concentration and attention. It leads to multiple errors, surgical mistakes, and poor memory. We're going to go in detail in this course, so I'm not going to be here. So we mentioned two stress hormones, the cortisol, the dopamine, and the rest. Now we try to classify stress into two: acute stress. These are stress that have short duration, it occurs and it vanishes. It's not likely to cause damage. Maybe you are preparing for exam, you're under stress. When the exam is over, you get relaxed. Or maybe you are going to jet out of breaks for the fact that you are not sure how the operation will be under stress. But if after the operation is over, the cortisol will absorb back. So acute stress is not harmful. As I said before, there must be stress for you to perform. Actually, anxiety is a normal human component. It's when it becomes a disorder. That means when you cross a boundary. Performance stress is needed for every action. It's only when you now cross. So acute stress can be said to be the normal stressful conditions. Then the other one is chronic stress. This is long duration. This is the one that damages the body. And that is one that many doctors are exposed to. Working in emergency, every day seeing 10, 20 patients. The next day you are consulting. When we are in UNTH, we need to start work around by 9. 140 bedded. Before we could reach the last floor, it will be around 4 p.m. So that means by 8 a.m. to 4, cortisol is circulating in our systems because everybody had to be standing. So the long stress are the one that actually cause the damage. Okay, studies have shown that females take longer duration of stress than men. The next. What are the stressors? We want to mention stressors are those things that cause stress. I repeat, stressors are those actions that bring about stress. You know, stress is a reaction. You cannot see stress, but you can see stressors. Maybe you are asked to pass an IV line, that's a stressor. By the time you are passing it, and maybe trying to navigate, reaction is going on in the system. And that reaction is releasing of the stress hormones, which cortisol is there. But if it's quickly resolved by cascade reaction, the cortisol is taken back. Okay, so stressors are those things that cause stress. It could be physical stressors. This includes injuries, pain, or it can be psychological stressors. These are negative comments. Maybe along the line, as I discussed, we say that cognitive stressors are more challenging than physical stressors. That somebody has made a comment about you. It has gone into your mind, you are internalizing it, you are relating it over days. Unlike somebody has slapped you, or you have a wound, or you have a pain on the wound on the leg, and pain is coming from. So the cognitive stressors are mainly negative comments, threatening voices. Then we can also say that stressors can be divided into absolute stressors. These are the ones that everyone that is exposed to it is likely going to witness stress. While the one we call relative stressors are the ones that not everybody, for example, if there is a traffic jam, so people will be worried, why has he done this? The cortisol is pouring down the system. But there are those who will not mind. But if there is something like a Boko Haram attack on insurgency, so everybody is going to feel stressed. So these are the ones we call the absolute stressors and relative stressors. Here's the next. Okay, the common stressors in environment, death of a partner, divorce, separation, relationship crisis. These are the list and many other ones. So these are the events that may trigger stressful reaction in a person. The next. Okay. In working places like hospital, so what are the common stressors? Medical emergencies, company policy or hospital policy, too much work to do. So that's where many of our doctors fall in. So we have so many work to do. There are so many patients to see, and there are long working hours. Poor workers making mistakes. Poor remuneration, that have been the issue. People were not adequately paid. These are stressors. Urgent deadlines. You know, urgent deadlines where this procedure must be done in the next 30 minutes. Otherwise, the patient may pack up. Then high targets, lack of cooperation, yes, the next. So these are common stressors. So what are the symptoms of stress? Cognitive, emotional, physical, and behavioral. And then cognitive symptoms, when one is under stress, that person's attention and concentration is impaired. There's poor memory, they can make mistakes. Emotional symptoms, inability to relax. Physical symptoms, pain, constipation, urinary. So as we're going down this, you discover that maybe one time or the other when you are stressed up at work, you must have experienced these symptoms. So we can divide them into cognitive, emotional, physical. Behavioral symptoms. You sleep too much or less. Then it can be addicted to drugs or eating too much. Okay, what are the health complications of stress? It's important to mention that stress causes hypertension, heart attack if one is under chronic stress. One is constantly being pushed to work for long hours. That person is at the risk of becoming hypertensive, heart attack, panic, anxiety disorder, sleep disorder, depression. So these are diagnoses that are associated with stress. Okay, so at work leads to poor productivity. So one, a doctor will have so many patients to see. It's likely that he or she may make wrong diagnosis. Decline in standard, multiple mistakes. There are so many surgeries to perform. By the time you get to midday, you're already tired. So you may likely cut what is not expected to be cut. It leads to any retirement, loss of job, and lack of job satisfaction. Yeah, the next. Okay, yes, scientists have tried to have scales where one can evaluate the effect of stress on his life at work. So there's a popular tool. This one is called the Holmes and Rahel stress scale. So these scientists developed a scale that you can use it to assess how stressful you are. So they have a score from 100 to 0. So this is a white scale. Of course, in environment, we may have to indigenize these stressors. They say that death of a spouse should get 100%. Then divorce is 73. It may not be in a marital separation, should have 65. Then jet time 63. If you go to 7, marriage is 50. So it means that one who is married to one wife, if he gets 2 wives, that means you multiply 50 by 2. So it's a popular scale. One can use it to evaluate how stressful. Okay, 3 wives, 50 times 3, and not 3, 50 divided by 3 husbands, okay. But yes, 3 wives, she tell me, okay, that one should be 50 divided by 2. Okay. So for the marital reconciliation, retirements, you can see sex difficulties, 39. Business readjustment, yes, the next slide. So the scale is quite long. Change in financial state, that of a close friend, 3. So these are the different scaling. So as I said, these instruments need indigenization. Because the 100, the one that scores 100 may not be in our environment. We need to find the one that many people are stressed. Change in church activities, 35, 19. Change in social activities. So after doing this scaling, you can assess yourself. I know what you are doing now, am I under stress? So that you can start seeking for treatment. And that happened to us many times in theater or war trials. The doctor may not know that he has exceeded the minimum. So you can see from interpretation there, if anyone scores above 300, the person is under high risk. The scores between 150 to 299 is moderate, and then less than 150. So with this scale, you can evaluate your states and know whether you need help or not. Here's the next. Okay, our major reason why we're here today, that I'm rushing a little bit, is to how do we manage stress? As people that stay long hours, our job is high risk. So how do we manage the stress so that we're able to cope? So we're going to look at the management options that are available. Okay, so yes, the next, back to this. Okay, so management, the spectrum of techniques that can be used individually or assessed from professionals to help overcome stress. Yes? So one of them, there is a popular management strategy that is demand control model. Demand control model. It's one of the mostly used model. In a hospital setting, this is very, very important. This demand control model means that operational stress technique, so 2 parameters, demand and decision autonomy. So it means that the demand for your service is high. Then you have autonomy to take decision. In our environment, as a doctor, you're expected to come to ward maybe or clinic by 8. You have a demand, you have the autonomy to say, let it be 10. So demand control model, that means the worker can make decision. The work is stressful, agreement is with the employer, let us do it this way so that the worker will rest. Can we do ward round and take a break by 12 and come back by 1? Can we take a decision that even if there are so many patients lining up for clerk, new cases, can we say we take only 5 or 10 in a clinic day? Wouldn't the management be annoyed that you are scared away patients that are going to other hospitals? So does the worker has autonomy? In a hospital like our own, many of our colleagues have Japan. Can we say by 12, no more new case? So demand control, enable the worker to perform. It's a high demand, but okay, when there is a high demand but little autonomy, the worker is suffering. Then if there is autonomy, the work is reduced. So demand control model, it helps to reduce stress. It has a monitor boundary so we can make progress. So this scale, this technique, this model can be employed here, maybe negotiated. Must a consultant come to work by 8? Can it be 10, 11, and this by 2, 3? No matter the volume of work. Yes, the next. Okay, so the mind control model as a team, so if you are working with other people, residents, more freedom for members to make decisions. So allow the residents. So let's have your opinions. However, some workers may still need supervision here. So the model control model, there is a head who dictates how the work should be done, but other members should make an input. So in our hospitals, the consultant happen to be the head. So the resident and health officers, they are co-workers. So there should be decision on how a patient should be seen. Are we all going to see the whole patient, or you see this one, you see this one, you see this? Yes, the next time. Okay, so one of the methods again that can be used to manage stress is rational thinking. As I said earlier, cognitive stress, that means negative thoughts, is a very high risk killing factor. When one is nurturing negative thoughts, maybe the environment where you are working, or even the co-workers, it produces high stress. So, cognitive management, for example, the hatred by senior colleagues, some of us think that our seniors are not the haters. So when we come to work, once we cite them, reaction have started. Or they are complaining that those in authority are deliberately not providing materials. Yes. You may not know that those in authority are handicapped. So that is common in our institutions, complain of, this thing is not being done because, so when negative thoughts, so this method teaches to have a rational thinking, begin to think that all are not well. It helps to relieve the stress or the burden at the workplace. Okay, so feeling of inadequacy, many times we say, we're not fulfilling what we're expected to do. Worry that your performance in your job will not be good enough. An anxiety that there's outside control. Yes, the next. Then how do we tackle feeling of inadequacy? You ask us, have I been trained and educated myself as well as reasonable should do? Does my work need further training? I'm not able to perform this surgery. Is it because I'm not a good surgeon? Does it mean that I need to go further posting? I'm not able to pass the truth. Does it mean that I need to go further engagements? So you see that you have not done what expected to do, so you don't say that you are not performing. Here's the next. Okay, problem with issues outside your control. Have you conducted appropriate contingency planning? Have you thought through and managed as likely risk? Worry about other. This is looking at cognitive stressors, negative thoughts, negative interpretations. How does it? Some of us listening to me may think that it doesn't matter. After all, I can use any word in the clinic and get. Whenever any of these negative thoughts are there, they trigger off these cortisol secretions in the system. So the purer the mind, the lesser the stress hormones. Yeah, the next. Okay, you can practice cognitive restructuring. This one is an advanced form of outward thinking. So this cognitive restructuring is a tool. Many times that experts will embark on to restructure the mind. It's talking about the thinking state of the mind. Because the mind produces stress. It's a stress, yes, the next. Okay, sometimes we may, in order to assess how stressful the situation is, a diary can be kept whereby on daily basis you try to record the stress that witnesses today, how recent event, how happy do I feel now, you are current. So on a daily basis, keep records, to keep track, record the stressors encountered, so that as time goes on, you can begin to look at these stressors. Okay, okay, rational thinking. When you keep a stress chart, you find out that these are stressors that is going on me. You begin to do rational thinking. Does it really mean that this patient that died last week is because of my mistake? Does it really mean that I'm the one that caused the quarrel in the yard or in the hospital? Okay, but it's when you keep stress charged. Yes, the next. Okay, there's one other method you can use, perfectionist. They are perfectionists who set high goals. If things are not gone the way, they're under stress. If it's not done this particular way. So perfectionism, we don't have an opportunity to look about personality types. Adaptive perfectionists work on developing their skills. So those that are perfect, they try to put up skills so that they can actualize. But the maladaptive perfectionists, they put stress on themselves. This thing must be done this way. Yes, the next. Okay, so cognitive restructuring, yes, I've done this. One of the things you can use to overcome stress is to practice what is called affirmation. Affirmation are positive specific statements that help to overcome stress. So if you are under a process and you are feeling stressed, you can say, begin to mention these words. They are internalized. I am happy, I can do it. Even though this surgery have taken hours, more than expected. Yes, I can do it. No state best, I'm successful. I'll be a leader in my office. So these are positive statements that build up the mind. Affirmative statements. So these are different strategies you can use to overcome stress at the place of work. This volume of patients, I'm able to see all of them. You internalize, because the moment you begin to say, this is too much, stress hormones are being poured out. Get the next. Okay, stress reduction in workplaces. There are some places where employee-assisted programs have been developed, whereby those in leadership will develop this program to assist employees in order to overcome stress at work or stress at the office, hospital. Yes, the next. Okay, now we're going to look into the clinical management of stress. How do we manage stress clinically? Yes, the next. Photogenic training. Progressive muscle relaxation have been shown to be very effective. Some of them can be practiced in the clinic. Progressive muscle management. Yes, the next. This involves sizing different. Okay, deep breathing exercise. You just sit down on the consulting seat. Put your hands by the sides and breathe in and hold the breath for about 10 seconds and breathe it out slowly. If you practice it, sometimes people fall asleep with deep breathing exercise. So if there are so many patients to see, I've already seen 20 are getting drowsy, you can take excuse. Sit down in the seat, sit and then put on and take a breath, a deep breath. Hold it for 6-10 seconds, then gradually breathe it out. Practice it for 2-3 times. You see that your body will come back. So deep breathing exercises have been proven to be very effective in the management of stress. Very easy to do. All you need is for you to relax. Yeah, the next. Okay, the next. Yes, so muscle relaxation. We try to involve different parts of the body. This one is the mouth. You try to open your mouth so wide. You open your mouth so wide, hold it, then close it. Then you tighten it. That's the mouth closure. Yes, the next. The muscles of the eye. You tighten your eyes, then you release it. You release it, you open it wide, and then you close it. So these are not that muscle relaxation technique. So we take different parts of the body. The neck. You turn the neck this side as much as you can go. You turn to the right as much as you can go. So you are relaxing the muscles of the neck. Because under stress, these hormones target this organ, these parts. Okay, so muscles of the stomach, you try to push out your stomach. So muscle relaxation technique can be done on the clinic. You don't need to meet a therapist. Okay, the next is muscles of the feet, it can be done. So hold it for 10 seconds, 20 seconds. So different parts of the body can be relaxed. Yes, the next. Now, autogenic training. When you're under stress, You can practice it. Say, I am relaxed and relaxed. Yes, I'm calm and relaxed. Even though there are so many work on me, so many people to see, but I'm relaxed. My legs are heavy and but relaxed. So many a times when you're under stress, you find out that there's kind of heat on the leg. I don't know those who have witnessed it. So, but and then the fear would be, I'm trying to develop stroke. But if you tell I'm relaxed, even though I'm doing so many things. You talk to orthogenic training. Yes, the next. Okay, finally, the physician burnout syndrome. Physicians, because of the high level of task, they are more the burnouts. Especially in our environment, where there are so many patients to see and few doctors. You go to emergency, they rush in 10 persons, there's only 2 doctors there. And then these 2 doctors expected to attend to all the victims. And before 1 hour, another set of accident victims will come in. So doctors are meant to be stressed out. So how do we manage burnout syndrome? As the MC said, many of us have gone through this sickness. It's a multidimensional. So today we will discuss some techniques that can be used to make sure you don't burn out in the medical practice away. Okay, so it's a characterized by emotional, mental exhaustion. So many work. You are physically exhausted, emotionally exhausted. Yes, the next. Okay. Yes, no, the last. Go back a bit. Okay. Depersonalization. No personal accomplishment and no esteem. The person begins to have diminished functioning. So burnout syndrome is there. I remember one day I was operating with a neurosurgeon. Before I became I was waiting for our job. Yes, Professor Onyebueke, the Memphis hospital. And that day we were to, there was a young lady, not young lady, 14 years old girl, a Jehovah's Witness in Delta. They were carrying Bible along, and many times through bullets, they passed from here to this place. The way they see it is confirmed that this is the entrance, and this is where the bullet is. And then, but unfortunately, there are no neurological deficits. So this girl was still moving hands, talking well, laughing, no neurological. So how can a bullet pass from here to here? It failed to traumatize brain tissue. And then they went to theater to remove it. I was only a robot assistant prof. We were shooting we have a mobile X-ray. Because the neurosurgeons are in the house, they know if you open the brain, common touching the brain can make that guy not to wake up, not to use the legs again. Because the brain, as you know, controls different actions in the body. So he was very careful. How do we remove the bullet that is here? We shoot X-ray so that it's here. You will try to get close. Get close again, we shoot. So many X-rays were shot in the theater. And at the point we all got exhausted. And I, being their sister, had nothing to offer. Yes. On final, that was when I started thinking that young girl was a Jehovah's Witness on a Bible mission, and that happened. At our last stage, you quickly put this, and behold, the bullet is up. And the girl came out of the theater, no speech was still there, hearing was still there. So if it's not carefully done well, so there was tiredness. So those of us that are surgeons, you may go in for a 1 hour surgery, you may end up spending 3-4 hours. Because complication arises, you're not going to close up. Again, when I was with him, pituitary tumor takes us from 9 a.m. to 10 p.m. Yes. We started by 1, we're chiseling here to get inside. And then by midday, we may still be chiseling. You cannot leave the patient there and go for a break. So medical profession is really challenging, and so epidemiology is common among physicians. Burnout syndrome, all specialists is at risk. Suicide rate is about 40%. among male physicians. So many male physicians, about 130% higher in females. Residents are not out of place, medical students. So Bonner syndrome is in all kind of medical upper training or profession. Yes, the next. Okay, so what are the risk factors for physician-Bonner syndrome? It can be individualized, organizational, society. So an individual may be the source of the burnout. One of them is personality type. There are those who are anxious, very aggressive, who want to work in 20 hospitals in a day. They are likely going to run into physician-Bonner syndrome. Another one to organize, yes, hospital setting, where the facilities are not there. Things are being hijacked. Society places so high much demand on doctors, so the doctor have to dance to the tune. Now, caring for the sick and dying is not an easy task. That when you walk into the ward, you see people with abdominal swelling, like medical wards. You see ulcer. The plastic surgeons know better. Some of them are having a odor that is irritating. You have to see them. So caring for the poor, for the dying, long working hours, as I said, in medical profession need a workaholic personality. Doesn't need gentle people who will just do one thing and get tired. You need people that can attend to many patients in a day. And that is personality type. So unfortunately, we go into profession because we want to belong. Okay, so administrative procedure like litigations. So these days, litigations, we are afraid as we do the procedure because second-hand traumatic stress, like needle punching, selfless desire to serve others. Some people go into medical profession so that they can serve as many as, and in this process they end up warming themselves. You want to attend to everybody, a means of wealth acquisition, and unfortunately, some of us remain poor. So these are the risk factors for physician-Bonner syndrome. Get the next slide. Yes. Okay, the treatment. Yes. So one of the treatment that is very, very important is that the physician should acknowledge that he is under stress and seek for help. So many a times we don't acknowledge that. Instead, we will embark in stomach infrastructure. We want to relax. We want to take 2-3 bottles of drink. I will mention the name. And then they take a amount of food. So identify that you have the symptoms. And seek for mental health help if the need be. If the need be that you are constantly having the symptoms of physician-Bonner syndrome, and then prioritize the recovery. So you can go on break to ensure that you recover before you come back to work. So this is one of the first things to do. As we are discussing today, identify when the symptoms are there, and then admit, acknowledge. Yeah, the next. Okay, so as a way of overcoming stress, you can engage in exercise, move your body if it's in the clinic, you may not walk. So body activity is highly advocated for stress management. If you don't do walk, at least do walk or indoor games. So that is an exercise to be able to improve your brain. Blood circulation increases in the brain during exercise. Do walk. So what are the things we can do? Yes, the next. So we are saying 2 things. One is acknowledge you're under the stress. Then 2 is engage in physical activities. Yes, the next. Okay. Sidewalk, body movement, high stress, high stake career. Okay, medicine is a high stake career, so there's no going back. That there may likely be physician-Bonner syndrome as the time progresses. Yes. The next. Okay, so we talked about this community restructuring. Practice gratitude. When you are under stress, you are reflecting on your inabilities. Acknowledge for accomplishment, reflect on your good work. So I have done this type of thing before. I've done this surgery, didn't get complication. So why this one? So reflect back on what positive things you have done. It will help you to manage, not to avoid cognitive stress. Reduce the influence of external and systemic pressures. So this is another you can do on this. Sometimes people embark on spiritual therapy for management of stress. It's important to acknowledge that there are limitations, both knowledge and skill. Don't go into a procedure with 100% assurance that you must surely succeed. So spiritual therapy is being practiced by many physicians all over the world. This spiritual therapy centers on actually there's a higher force. You can realize that God is knowledge. So try to acknowledge it before engaging in any procedure, so that even if the procedure happens to get trouble along the way, you can have a way. So it's when you rely solely on yourself, provide resilience that help manage stress. So spiritual therapy has been proven to be effective. Paul, in one time in Philippians, was making prescription to the Philippians, telling them that they should not worry, stress should not, but in everything, they should by prayer and supplication with thanksgiving. So this is a prescription for stress. That if you are at work and you are stressed up, you can ask for higher help. Yes, the next. Okay, so preventive measures to abort stress in medicine. As we said, medical practice is bound to be stressful. The patient that looks benign in the course of treatment become chronic. So this one said, time and energy is demanding high stress. Manage demand of your work, as you said earlier. Try to prioritize how many will I see. Should I see everybody? Prioritize responsibility, delegate duties. And then of course, phone is one of the areas of stress. It's a stressor for medical practitioners. But many times, even when you are eating, patients are calling. And some of them you may not be able to refill their calls. So answering phone is a stressor. The negative remarks there or stories or comments will trigger off secretion of cortisols. Yes, the next. Okay, so there's a physician burnout coaching. So this coaching is popular. The physician burnout coaching is, or the most important one is what we call the happy MD. The happy MD is the most popular evidence-based. It involves one-to-one talking with doctors, how to overcome stress. In place of this pipeline, you should have such happy MD structure, so that you can, from time to time, meet the team or the happy MD. They will talk to you based on your personality and your specialty. If you are a physician, it's not the way they advise a physician that are going to talk to a surgeon. So happy MD is engaged in hospitals and working places to help, especially the young doctors. The happy MD is a document that tries to do one-to-one talk and treatment. So we can adopt happy MD here. It needs to improve resilience, job satisfaction, and better, and also gives high quality of life. So where there's happy MD and is known to the hospital community, a doctor that is under stress, especially those in emergency, they can intermittently go to the happy MD post and receive treatment. Yes, the next. So these are preventive measures. So those in leadership stress, yes, leadership stress, as some of us may be, leadership also contribute to the stress. And then this stress, adding to the work of a doctor, will eventually lead to a severe physician burnout stress. Get the next. Okay, so financial stress, you can't feel it without mentioning, especially to an environment. Finance is a strong stressor. The money to pay for house rent, renew your NEPA bills, and fuel the car. You come into the morning, all these thoughts will jump into you. You're meditating how to pay school fees, you're meditating how to pay school fees, and then buy fuel and the rest. So, and then go to work and stay long hours. And that's the reason why many of us jump from one hospital to another. So finance is a very big stressor. So in order to curtail this, they're what they call the white coat investor. It's a program. It has a website where it targets doctors, people on white coats, how they can invest their money and overcome financial stressor. Because when you are financially down, the hormones will not rest. So one of the things we can do in the environment is cooperative societies can help. And then of course, financial investment opportunities. And then that will equally bring us to, one of the reasons why financial stress is very prominent among doctors, because our ego in the society has been overflowed. People assume that we pack money from hospital in our boots, and every occasion we should feature and contribute. So this is a wrong idea that has put us onto a financial stress. In conclusion, we should understand that medicine is a calling, not really a profession. Yes, you can have law as a profession, engineer as a profession. Medicine is a calling to cater for the body, soul, and spirits. So if we are in it and we fail to understand this, it's likely that burnout syndrome will come. Your partner with the maker of man. It's a vocation really, not a money-making entrepreneurship, and not an ego booster. So why there are so many physician burnouts is because the entrance has been punctuated to make money, to become known, and to belong. Unfortunately, many of us have had serious complaints. The money has failed to come, and we are growing older. And young people that jumped into one business or the other just 2 years back, they have a fleet of cars. And they come to village now this Christmas, they may be distributing 50,000 an envelope. Why we can hardly buy fuel to get home. So medicine is a calling. Working on it without acknowledging this simple idea is likely going to put stress. The patient we are treating may not pay us. Many times in private settings, we may sacrifice to treat the patient. And of course, even in the hospital where we work, our pay is not commensurate to our inputs. So until we understand this, so we have outlined some of the methods to overcome stress and public and physician burnout syndrome. You need to organize a periodic burnout symposium. It will help this community. Okay, finally, yes, the last slide. Thank you for listening. I know.
Thank you so much, Prof. Thank you.